Awesome. We'll get started. And thank you again, everyone, for joining. My name's Neil, and welcome to the Navigating Employment Reforms in the Disability Sector webinar. We're joined today, or we're happy to host today with Citation Group. So just before we kick off, just a little bit of housekeeping about the webinar. So we want this to be interactive. If you do have any questions, please use the Zoom Q&A function. Ask those questions away in there, and we're going to do our very best to get through and answer all of those at the end of the webinar. Any that we don't get time to answer in the webinar, we'll get answers out to everyone after the webinar. We will be leave time at the end to do these questions, but don't wait till the end. As the questions are flowing into your mind, please just put them into the Q&A function so that we can collate those and get through them all at the end. As I said, we'll aim to get through as many of them as possible, but if we don't get to yours today, don't worry, we'll be in touch after the webinar to get the answers to you. And yes, this is being recorded. If you've got any colleagues that weren't able to make it, but want to have access to it, we'll record this and send it out to everyone that's registered after. We have quite a few people joining us today on the webinar, and we're excited to be hosting this in partnership with Citation Group. Many of you are probably here today because you know how difficult and challenging it can be to navigate employment in the constantly changing and complex disability environment. I'm really glad that you've joined us today. By the time we finish, you should walk away with some really useful tips and practical advice. Just a couple of intros for myself and Nicole. So my name is Neil. I'm the sales manager over at ShiftCare. ShiftCare is a care management software. And we've got Nicole from Citation Group. Nicole is a senior associate and workplace mediator at Citation Legal, based in Brisbane. She's over 25 years experience in human resources, having held several senior HR management roles in both large national and international organisations. Nicole has extensive experience working for large organisations in strategic human resource management, workplace relations, organisational change, process and system improvements, and project management. Drawing on her dual expertise in HR and law, Nicole is a skilled legal advocate in the workplace relations matters, representing clients in the Fair Work Commissions and other tribunals. Her practical background enables her to balance legal arguments with commercial and organisational realities, making her a highly effective workplace relations lawyer. Thanks, Nicole. Jump on to the next slide there. ShiftCare and Citation Group are excited to partner today to present today's webinar. Citation Group has been around for over 30 years, working to help Aussies and Kiwi businesses by providing complete workplace compliance solutions to help create better workplaces. From outsourced HR, safety management systems to ISO certifications, Citation Group can support your business through a whole range of needs. Today's webinar, and just onto the next slide, please, Nicole. Today's webinar features Citation HR, so a complete, compliant and cost-effective solution that helps businesses keep on top of their HR obligations, streamline people management processes, and save you endless hours and resources. As you probably already know, it's important to have a solid HR partner who understands the complexities and specific challenges of businesses like yours face throughout the NDIS and the disability industry. The team at Citation HR are experienced and ready to help your business, from 24/7 HR advice line, HR software, and a library of HR resources, to the Advice Promise and Compliance Training Centre. They have a range of solutions to suit your needs. There'll be more information on how to get in touch with Citation Group throughout the webinar. We'll put some QR codes up there as well. And lastly, before we jump into the agenda, just a quick intro on ShiftCare. So ShiftCare is a care management software, super easy to use. We are lucky enough to be the most commonly used software for the NDIS in Australia, with over 6,000 providers. A main approach for ShiftCare, apart from sort of managing the day-to-day, is just to try and alleviate all of the burden that comes with the administration and compliance, just so you can focus on looking after your clients. that's it for the intros. I'd love to pass over to Nicole now to talk about today's agenda. Thanks, Nicole.
Thanks so much for that, Neil. Well, hi everyone. Thanks for joining. As Neil said, my name's Nicole Vecito, and today we're walking through the most important employment law and compliance updates for the disability and NDIS sector as at today. We'll keep the session practical with checklists and concrete actions, and you can take these away and start to implement straight away. Everything today is general information. It's not legal advice, so please get some advice for your specific circumstances if you need to. We'll save, as Neil said, we'll save the questions for the end so we can keep the momentum going, but please pop them in the chat box along the way so they don't get forgotten, and we'll share the slides and resources after this. So let's get started. This session is for business owners and leaders, HR and payroll teams, rostering and workforce planners, and quality, risk and service managers. We'll cover both award-covered providers and those operating under enterprise agreements, because most of the pressure points show up in both. The focus is on practical steps, what to check in payroll, how to tidy up rosters, what to document, and where to monitor for changes. Again, this is general guidance. You'll want to map out these ideas onto your own workforce mix, your funding model, and your state-based obligations. So here's the plan for the hour. First, we'll discuss the Fair Work Ombudsman's inquiry into disability support services. What is it and what does it mean in practice? Second, the gender-based undervaluation case, that is quite a mouthful, which has been running through the Fair Work Commission, which has the SCHADS Award squarely in its focus. Third, the latest on the SCHADS Award changes and classification issues that have arisen. So we'll briefly reflect on the changes from 2022 through to 24 and some of the more recent 2025 updates. Fourth, we'll talk about the new New South Wales Portable Long Service Leave Scheme for the community services industry, who's covered and what to do. And finally, we'll have a quick but important refresher on WHS obligations for NDIS providers. We'll wrap up with a Q&A and point you to some key resources. So let's get started with that Ombudsman's current focus for our sector. Alrighty. So as many of you will know, the Fair Work Ombudsman, or the FWO, as you may have seen it referred to, has been active in the disability support services sector for several years. But on the 29th of July this year, it significantly escalated its efforts by announcing an 18-month major inquiry into compliance with workplace laws across the sector. Now, this isn't a superficial review. The Fair Work Ombudsman has already been engaging with our industry for the past 4 years. In that time, it's handled more than 75,000 inquiries from workers and employers, received over 2,500 anonymous reports, resolved more than 3,000 non-compliance matters, and recovered almost $68 million in unpaid wages. That gives you a sense of just how serious the compliance issues have been in our sector. So what is this inquiry about? The Ombudsman has made it clear that there are serious concerns about systemic non-compliance in the sector. The focus will be on understanding why the breaches keep occurring and what business behaviours are driving this. The inquiry will engage not only with employers, but also with support workers, clients, and platform operators. That means if your organisation engages staff through labour hire, casual arrangements, or gig-style apps, the Fair Work Ombudsman wants to hear about it. Some of the key issues already identified include high casualisation and workforce turnover. Many providers rely on casuals to maintain flexibility, but this often comes at the expense of compliance with minimum entitlements. There's also a fairly strong reliance on migrant workers who are more vulnerable and may not understand their rights or feel confident to enforce them. They are in particular, a prime candidate to raise their concerns to the Ombudsman because they don't feel comfortable or confident raising it with their employer. Rising labour costs and tight margins, particularly under the NDIS price caps, pressure from digital platforms, with some providers competing against unregistered operators that undercut them by not complying with workplace laws. And of course, all these compliance complexities due to the ongoing reform agenda that we're talking about today. The inquiry is sector-wide, so employers, workers, platform businesses, labour hire providers, and NDIS participants are all within scope. The Fair Work Ombudsman is seeking input and will be running audits and compliance checks. In practical terms, you can expect data requests, audit notices, interviews, and targeted follow-ups. The tone is evidence-based. The Fair Work Ombudsman recognises the complexity of SCHADS, high casualisation, variable hours, and funding pressure. But if underpayments are found, they will expect remediation, potentially formalised through an enforceable undertaking. Our approach today is proactive. We want to talk about what you can do to tighten things up now so that you're confident if the Fair Work Ombudsman does contact you. So from what we've seen in this sector, here are the hotspots for the Fair Work Ombudsman officers that they are likely to target. So firstly, award coverage and classification mapping. This is your, I guess, your starting point to check, are people on the right instrument? Are levels and pay points correctly assigned? Do your engagement or contract level letters clearly state the stream, level, and pay point that applies to your employee? Secondly, minimum engagements, broken shifts, and allowances. So are you paying the minimum engagement periods when clients cancel late? If you're using broken shifts, are you within the cap and paying the correct broken shift allowance? Sleepovers, 24-hour care, and on-call versus recall. Sleepovers are particularly technical. How they interact with shift span and overtime really matters. Travel time between clients. So travel between clients is typically paid time. On top of that, there's a per kilometre allowance where applicable. The method for calculating time and distance should be documented. Casual conversion and fixed term limits and record keeping. Can you trace each payslip component back to a timesheet and roster? Because essentially that's what the Ombudsman will be looking to do. And finally, contractors and platforms. If you're engaging sole traders, ensure there's no sham contracting risk. If the Fair Work Ombudsman identifies issues, they'll look for the steps you took to self-identify and to fix them. So here's a practical 30-day plan. We suggest starting with a payroll triage or payroll spot check. Pick out 20 random pays and confirm that your employees are paid the correct penalties, allowances, overtime, and loadings, and that those things are being triggered correctly by your systems or in your sort of timesheets and rosters. Reconcile sleepover hours, what's active versus inactive, and ensure travel between clients is both recorded and paid. Secondly, rostering hygiene. Make sure the minimum engagements are honoured, even when sessions are cancelled. Avoid a third unpaid break unless you have explicit employee agreement and are paying the correct broken shift allowance. Documentation, so pay records and timesheets and classification letters. Refresh your letters. Ensure that every employee has a stream, level, and pay point stated, and that your position description actually matches the level descriptors in the award or agreement, whichever may be the case. Check that your pay records and timesheets are contemporaneous. Fix any gaps now, not during an audit. Excuse me. Engagement with the Fair Work Ombudsman. Nominate a single point of contact who's going to be the person within your organisation that's going to deal with the Ombudsman. Subscribe to the Fair Work Ombudsman updates, and if you uncover any underpayments, consider what your self-reporting and remediation plan might be so that you can control the process and the costs. Doing these 4 things now will dramatically lower your risk profile. Righty, next we'll jump onto the Fair Work Commission's gender-based undervaluation work, which has SCHADS front and centre. So this decision came out of the Commission's Priority Awards review, which was required under the Secure Jobs Better Pay Act. That legislation made it clear that the Commission must actively promote gender equality and ensure that the award system reflects fair and equitable pay, particularly in female-dominated professions. Unsurprisingly, the SCHADS Award, covering the disability and community services sector, was identified as a priority. This is because our workforce is overwhelmingly female, and the evidence shows that many of the roles have been historically undervalued due to gendered assumptions about care work. The expert panel found that several classifications in the SCHADS Award had indeed been subject to gender-based undervaluation, and as a result, the Commission proposed to abolish the existing 5 classification structures and replace them with a single simplified classification and wage framework. They also proposed to revoke the Equal Remuneration Order that has been in place since 2012. Now, you might be wondering, what does this mean in practice? Essentially, it means that disability support workers are set to receive higher pay rates under a new structure that better reflects the skill, complexity, and emotional labour of their work. The precise wage increases are still being finalised, but we know they will be substantial. For providers, this has 3 big implications. Firstly, of course, labour costs are going to rise significantly and providers will need to budget accordingly. Compliance readiness will be critical, so employment contracts, position descriptions, and payroll systems all will need to be updated. And funding considerations are front of mind. The Commission itself has acknowledged that implementation will depend on government funding adjustments. So where does this leave us? For now, providers should monitor Commission updates, participate in the consultation process if you'd like to, and start preparing workforce plans. This decision isn't just about pay, it's about elevating the recognition of care work in our society. But from a business perspective, we cannot ignore the cost and compliance consequences. The key dates for you to put in your calendar are the 27th to the 31st of October 2025. That's when the full bench hearings for SCHADS are scheduled. Implementation timing and any wage adjustments will follow shortly after in formal determinations. The key takeaway for today is simple. Watch this closely. Don't lock in numbers yet, but do prepare. So what might change exactly? First, simplified classifications. Instead of 5 separate streams, the Commission is considering one unified structure with clearer descriptors across social and community services, home care and disability work. Second, re-levelling. To address undervaluation, some roles may move up, which would put upward pressure on minimum rates. Third, transitional arrangements. Expect measures like red circling or absorptions to prevent pay reductions where descriptors shift. What I mean by that is when they do this re-levelling process, there may be some roles that go up a level and therefore become entitled to a higher pay rate, and some which might also go down a level. But the Fair Work Commission is never going to order a pay reduction for someone. So what we might see is some of those rates that do go down get frozen until such time as the award catches up, the new award, that is. Fourth, funding and pricing. Any changes will intersect with the NDIS price limits and state funding. So build some scenarios now so you can quickly respond when the determinations are handed down, likely to be in November. So I'll show you a quick preparation checklist, very limited. So 3 things: map your roles to the proposed levels. Even though these might change, it's a good exercise to go through to understand how they're currently proposed to sit. So build a Excel spreadsheet or a Word document and draft out where your roles sit today in the SCHADS Award. What are they classified as in terms of their stream level and pay point? And how might those same roles look under the proposed new structures? Flag roles that could be compressed or misaligned under the new structure. Budget scenarios, we would suggest modelling a 3, 6 and even a 10% wage movement across your SHADS workforce and see what happens to the program viability and pricing. Contracts and communication, suggest updating position descriptions so they actually match the descriptors. That is, your position descriptions actually match with those descriptors in the award. Not a bad thing to do that now and update again in November when we get the revised award. And the reason for this is it's good evidence, again, coming back to our Fair Work Ombudsman campaign. If you are approached for an audit by the Ombudsman, it's good evidence to demonstrate why you have assessed someone at a certain level and therefore why you're paying someone at a certain level. So update your position descriptions so that they do reflect those descriptors in the award. Draft some communications for staff and for funders or participants in case rates need to change. Of course, those would remain in draft format until we get confirmation in November or later. If you do this groundwork now, you'll be able to implement quickly and confidently once the Fair Work Commission finalises its outcomes. So let's switch to the SHADS Award itself and the key updates that you need to keep on your radar. So a quick refresher on some of the changes that occurred in between 2022 and 2024, broken shifts. As it is today, you can generally have up to 2 unpaid breaks in a day. A third requires agreement, and I would strongly suggest, if it doesn't actually say so, that agreement should be in writing to a third shift. And of course, the correct allowances should be paid. Minimum engagements and cancellations. If a client cancels late, minimum engagement rules often still apply. You can't simply not pay someone because the client has cancelled. So double check those minimum engagements. And I think I might have mentioned this briefly, travel between clients. This is typically paid time, unless you've got something otherwise in an enterprise agreement. And so the time that someone spends traveling from one client to another is typically paid time. And on top of that, if they are in fact using their own vehicle, there is a per kilometre allowance that's payable in addition to the paid travel time. So decide and document how you calculate your travel time and distance. And I would strongly suggest having some kind of travel policy that communicates that to employees. Records and conversion, casual conversion. So keep some accurate timesheets and pay records. Manage casual conversion and obligations proactively. There have been changes in the Fair Work Act in respect of casual conversion, so seek some assistance in respect of that, but there are some pretty strict and express timeframes that you need to respond to any requests for casual conversion from staff. So these are the areas that payroll audits most often sort of uncover underpayments. Those which are we expect will arise in the future in this year include, I wonder if I've got this on the next slide. No, sorry. So sleepovers. No, it's on that previous slide. There it is. I just can't see it because I've got people in front. So for 2025, sleepovers. In July 2025, the federal court held that sleepovers are separate and distinct from a shift under SCHADS. That matters because of how you assess overtime, span of hours, and penalties. Now, the Fair Work Ombudsman has appealed this decision. They disagree, but for now, manage rosters and payments in line with the current judgment and monitor the appeal outcome. Second, travel to the first and last client in March 2025. The Fair Work Commission declined to amend the SCHADS Award to require payment for an employee travelling from home to their first client and from their last client to home. So the existing rule remains, and that is that travel time is payable between clients only. And third, of course, the pay guides. So I'm sure you're all familiar with the national minimum wage decision that takes place towards the end of June each year. Consequently, the pay guides that come out of that decision and that increase have been updated. So have a check of those and make sure that your pay rates in your payroll system and configurables all are up to date. So if you do nothing else after today, I would suggest confirm your sleepover settings and your travel time calculation method. I've sort of touched on these for a variety of reasons, so I won't go through them into greater detail or repeat myself too much, but safe to say these are the typical pain points for those operating businesses in the disability sector and NDIS service providers. So these, I guess, as a starting point, I would highly suggest that you double check these things, make sure they're correct and aligned with either the award or your agreement as it applies. So let's move on to the New South Wales new portable long service leave scheme for community services industry. This commenced on the 1st of July 2025 and applies to eligible employers who provide community service work in New South Wales. So this includes disability supports and NDIS services. It covers full-time, part-time and casual employees. Self-employed contractors can also opt in themselves as workers. Importantly, work done for self-managed NDIS participants still counts for coverage because the scheme focuses on the nature of the work, not who funds it. So just be cautious though if your business does extend outside of disability support, because not every adjacent sector is in scope. For example, residential aged care isn't currently included. So check your program mix and against the scheme categories to determine who would be eligible and who this applies to. So how it operates, workers accrue portable service across employers. So after 7 years of recorded service, they become eligible for 6.1 weeks of long service leave, with further accrual beyond that as well. Employers lodge quarterly service returns and pay a levy of 1.7% of ordinary remuneration to the Long Service Leave Corporation. The scheme started on the 1st of July this year, and the first service returns and levy payments covering the initial quarters are due from April 2026. So there's also a foundational service credit. So workers included in the first returns will receive a 365-day service credit to recognise the scheme's commencement phase. So your action point is define what counts as ordinary remuneration in your payroll system so the levy base is accurate. So what I mean by that is many of you will be familiar with ordinary time earnings for the purpose of determining what is superable. Similarly, goodness, I've just lost my notes. This is referring to ordinary remuneration, and so we need to determine what that includes and make sure that your payroll system is identifying just those categories of entitlements so that your reports report the correct amount that you submit to the corporation. So some practical steps. Assess eligibility. So map your programs and roles against the scheme's community services categories. Include any labour hire arrangements. Set up your worker records. I think you can go into the New South Wales Long Service Leave Corporation website and actually start setting up your worker records. Create a tag in your payroll system so that it's capturing those earnings that are relevant for that 1.7% levy. Do some testing of those payroll reports so that you're ready for April next year. And budgeting, you might choose to also model that 1.7% levy in your budgeting. And now is a good time, plenty of time to review your long service leave policy to make sure that it captures this new portable long service leave scheme. So finally, just a short, but I guess crucial refresher on WHS duties for NDIS providers. As NDIS providers, you are PCBUs, persons conducting a business or undertaking under the model work health and safety laws. Your primary duty of care is to ensure, so far as is reasonably practicable, the health and safety of workers and other people affected by your work. That duty includes providing a safe system of work, information, training and supervision, and consultation with your workers and work health and safety reps on WHS matters. Psychosocial hazards aren't optional anymore. The code of practice set clear expectations about identifying and controlling risks like aggression, traumatic events, excessive job demands, and remote supervision. Overlay this with the NDIS practice standards, which require a robust incident management, worker screening, behaviour support and quality systems. So think of WHS and NDIS compliance as one integrated safety system. So here are the scenarios that we often see lead to harm if they're not managed well. So in your sector, I should say. Working alone in client homes where behaviours can be unpredictable. Some controls might include a pre-visit risk assessment, behaviour support plans, check-in systems, and access to duress support in the event that something happens. Manual handling and transport, so the risks could be transfers, mobility aids, and vehicle use. Some controls that you might put in place or consider could include task-specific training, appropriate equipment and vehicle safety checks, and also fatigue management for those engaged in after-hours transport. Medical assistance and clinical tasks under delegation stay within the scope of your practice and provide that training, competency-based training and clear escalation pathways to your staff. And finally, psychosocial hazards. So things like exposure to aggression, vicarious trauma, and high job demands. Some controls for this might include looking at your staffing levels, supervision, debriefing after incidents, and access to EAP or equivalent support. So make sure these controls are also reflected in your SWIMs or your procedures, and that supervisors verify that they're actually being used in the field. If you do have an incident, it's important that you know whether or not it's a notifiable incident. You must immediately notify the WHS regulator of a death, a serious injury or illness, or a dangerous incident. When a notifiable incident occurs, preserve the site, except, of course, where there's an injured person that needs assistance or to make the area safe. Have a 24/7 escalation pathway so staff can reach a competent manager at any time, and record all notifiable incidents for at least 5 years, or maintain those records for 5 years. So examples in our sector include serious assault on a worker, a vehicle collision during client transport causing hospital treatment, or an electric shock from faulty equipment in a participant's home. These are all serious incidents that likely need to be reported as a notifiable incident. We suggest that you review your incident management procedure against these requirements and run a short tabletop drill with all of your on-call supervisors. When we say reasonable adjustments in the context of work health and safety in the disability sector, we're actually talking about two things at once and also quite distinctively. Firstly, our employment duty to remove barriers for workers with disability, and secondly, our service delivery duty to tailor how we support participants to work safely without creating any new risks for workers or others. So the legal anchors, I should say, are quite simple. Firstly, under the Disability Discrimination Act, failing to make reasonable adjustments can be unlawful discrimination unless doing so would cause unjustifiable hardship, that is, major difficulty or unreasonable cost that you can't practically overcome. Many adjustments are low or no cost, and government funding exists for eligible modifications. At the same time, our WHS duty doesn't change. As a PCBU, we must ensure health and safety so far as is reasonably practicable. So the test in Section 18 asks us to weigh up the likelihood and severity of harm, what we know or should know about the risks and controls, the availability and suitability of those controls and cost, with the aim of providing the highest level of protection that is reasonably practicable. That's the lens we use when designing or trialling adjustments. So how can we put that into practice? We need to consult with workers, of course, and relevant health and safety representatives. That is one of the core duties identified in the Work Health and Safety Act. Need to design the controls that can be put in place, overlay these adjustments or considered adjustments with the NDIS practice standards, and use the available funding. So the Employment Assistance Fund can reimburse many workplace changes for things like equipment, Auslan interpreting, assessments, so cost is less likely to be a barrier. If an adjustment would introduce an unacceptable risk or genuinely can't be done, document the Section 18 risk analysis, the alternatives that you've considered, the consultation that you've undertaken, and why proceeding would not be reasonably practicable or would cause unjustifiable hardship. Then offer the safest, effective alternative. So the takeaway from this slide is that reasonable adjustments and work health and safety are not in tension. They're the same design problem, creating safe, dignified work and support. So most adjustments are straightforward, improve safety for everyone, and when we consult and document, they generally stand up to both WHS and NDIS audits. We've got a couple of resources here, and I appreciate that you can't actually see the URLs behind these links, but we'll send these out so that you can click on those links. I'd just suggest bookmarking these, share them with your payroll team, rostering, quality, work health and safety teams. And that is it from me. So we'll jump into some Q&A.
Awesome. Thank you very much, Nicole. That was very interesting. I was making a ton of notes in there as well. We do have a lot of questions. I'm going to hit you with some of them. Some of them are pretty technical, and I'm not 100% sure if you'll be able to answer them on the webinar, but let's give it a crack.
Yeah.
And so the first question is, and I'm reading verbatim here. So are you saying that legislation requires us to pay an hourly rate and an amount per kilometre when driving between shifts, between clients? So kilometre rate and a labour cost.
Yes, that is correct. So when an employee is traveling from client A to client B, there is under the SCHADS Award an obligation to pay for that travel time at the applicable hourly rate. And if that happens to be a penalty rate, then at that rate, as well as the kilometre reimbursement. Now, the kilometre reimbursement is where the employee is actually using their own motor vehicle. So if there's a company car being used or they're provided with a vehicle, then that kilometre reimbursement wouldn't apply, but otherwise it does.
Awesome. Thank you very much for answering that. The next one is, if I identify underpayment in-house and correct it in-house, does it need to be reported?
That's a very good question, and it really depends on a number of factors. It's not uncommon for employers to be notified by an employee that their pay last week was incorrect, and an employer liaises or consults with that employee and fixes it up. In that case, I would say no. If there is a systemic underpayment that goes back quite a period of time and perhaps affects a large number of employees, then I would encourage the employer to consider whether or not they do need to report.
Yeah, I get the impression that it's probably the latter of those that the person asked the question is referring to, but yeah.
Yeah, if you do find yourself in that situation, I would strongly suggest that you give us a call and we can assist not just with making that decision, but also assist with that communication with the Fair Work Ombudsman. We have, I can't even count how many of those type of matters we have on the go, and there are certain things that you need to really be prepared for, particularly once you've reported. It's good for us to be able to advise on what are the things that you might have to do in addition to just repaying those wages or remediating that underpayment once you self-report.
Awesome, thank you. The next one's very specific, and hopefully you can answer this because I can't get it off the top of my head. When paying the kilometre reimbursement, should we continue to pay the 88 cents tax-free and the 11 cents taxable?
I am no tax expert. I would have thought it was just all paid as an allowance. I guess it depends whether or not you're paying it as an expense reimbursement or whether you're paying it through the payroll. I can't answer that one. Sorry, tax is not my forte.
We've got someone else that's answered a question that says the answer to the kilometre question is yes. But let's just put a caveat in there to say, please contact your tax advisor for that one. But thanks for trying. The next one here is, can you elaborate when a sleepover is rostered and the client requires assistance in non-active time? How is that paid? So a sleep disturbance?
Yeah, sure. I don't actually have the award in front of me, and my other computer has decided to go to sleep and die. Um, so that is one question that I will come back to that person on, if that's okay, because I want to give it's a great practical example, and I want to give a detailed response to that. So thank you for the person that raised that question. Sorry, my other computer's died, so I can't bring up the award, and I don't want to bring down the screen. So I'll respond to everyone following this, if that's okay.
Excellent, thank you. And just for everyone that's watching, that's joined, all the answers to these questions we are going to share with the recording as well. So the next question is actually, is it possible to watch this recording from the start? Which we answered, yes, definitely we'll share that recording with everyone from the start. But the question after that is, after some clarification on client cancellations. So if the staff member is casual, what point do we have to pay the staff member? Is it less than 7 days, less than 24 hours, etc.?
Um, so the 7 days is for your full-time, part-time employees. Casuals are paid and engaged as such. There there are sometimes some minimum engagement. There are minimum engagements listed in the SHADS. If a casual employee has already commenced their shift, then those minimum engagements would apply. But I would suggest that if they haven't yet commenced their shift, you can give them notice that they're no longer required for that shift.
Awesome, thank you. Next one here is relating to the long service leave scheme, or the portable long service scheme. How does the portable long service leave scheme work between states? Is it cross states agreement, or is it purely held within one respective area? There was just a couple of questions on that.
Yeah, great question. And I thought that one might pop up because yeah, it's very common for particularly where you've got businesses or employees close to the border, that they might do some work across Queensland, New South Wales, or Victoria, New South Wales. Typically, they would if the employee is based in New South Wales, that is, they live in New South Wales and they perform work, then typically that work would be included. I'm not sure how that would apply for some of those independent contractors that are opting in themselves, whether or not that's different. But I'll look into that and make sure we include that in our response. Hopefully that answers the question. It's where the employee and employer are based.
Thank you.
That way you're not needing to sort of dissect, well, where did that person drive? Did they go over to the border to do that work or not? I think it is sort of fairly clearly cut. If the employee and the employer are in New South Wales, then it applies.
And just this is a follow-up question from me. If you have a person that has worked in, say, South Australia for a year and then moves to New South Wales and works there for a year, is that covered by the scheme?
No, if the employee was, or for the period that the employee was in South Australia and working in South Australia, the scheme would not apply to those hours worked.
Yeah. Okay, awesome. The next question is just, it's back relating to the question about casuals and cancelled shifts. If the answer that you gave about casuals was if they're on shift and let's say the person says, hey, I don't want you here anymore, I'm going to send you home. Obviously, they have to get paid for that. What about if it's like the half an hour before and they're on their way to the shift as a casual worker?
Well, look, I have to again bring up the award, but and I'll respond to that in detail in our response. I'm really sorry. I did have the award up on a separate but it's died. But my thoughts are that, well, just like it's open to a casual to accept or reject a shift, it's also open to an employer to offer and withdraw a shift. That is the nature of casual employment. There's no guarantee of work. So, based on the definition in the Act, I would say that it's okay for an employer to cancel a shift if it hasn't yet commenced. But once the employee has commenced the shift, absolutely they would be entitled to that minimum engagement pay.
Awesome, awesome. There's another question here that's very, very specific, and it relates to sleepovers and things like that. I'll probably just include that question in our list that we send out because it talks about specific scenarios and things like that. It's a good question, but we'll make sure we answer that in the information that we send out.
You want to just read it out so that those who are sort of
Yeah,
umming and ahhing about whether they're going to read those, if it
yeah.
applies to them, they might make a more of a point to open it.
Good shout. So if someone is scheduled to work before and after a sleepover, and they would historically receive overtime due to working 10 plus active hours, i.e. 2 p.m. till 10 p.m., sleepovers 10 p.m. till 6 a.m., and then active 6 a.m. till 10 a.m., would the hours from 6 a.m. till 10 a.m. be treated as a new shift and not applicable for overtime for the last 2 hours under the recent ruling, even if they have in the past?
Yeah, great question. And whoever raised that, you're absolutely right. The recent ruling in the federal court is particularly relevant to that. So thank you for the question. I will answer that in some detail for you.
So, we've got a couple more questions. We've got a little bit of time, so I want to try and get through some of these. This question here is probably just a sales question for Citation. Our organisation needs to work on tightening up our policies and procedures and EA. I'm not sure whether EA means enterprise agreement or not, but who can we consult that will help us with that?
You can contact Citation HR. We've got a scan sort of a URL code here, and anyone on this call today is entitled to a sort of a 30-minute free consultation with our team. That is a good starting point. They are able to assist with all types of queries in relation to sort of the full employment cycle. They were also able to assist with inquiries in relation to enterprise agreements and the process for putting in place a new enterprise agreement. If someone wants assistance with, with sort of a third party, such as Citation, acting as a bargaining representative for their organisation to put in a new enterprise agreement, we would be able to assist with that through our Citation legal team and do that daily. So start with the Citation HR team, but if you're actively looking to put in or renew or put in a new enterprise agreement and you'd like a bargaining rep or further assistance with that, give our Citation legal team a call.
And you could also scan the QR code on the page now, right?
Yes, it should be up there.
Yeah, yep. There's a couple more questions. This one here sort of relates to sleepovers again. So can the 4-hour minimum engagement for a sleepover be spread across both before and after the sleepover, or is it either 4 hours before the sleepover or after the sleepover? Does that make sense?
Yeah, it does. It does. I'm going to pop the response to that in our response that follows, if that's okay. Just because it's one of those questions I need to look at the actual wording of the clause, and I'm so sorry, but it's gone down. So I will respond to that one as well.
No one is going to hold it against you for not knowing the SCHADS Award word for
Oh,
word. If anyone out there knows that, then they might have too much time on their hands. So a couple more questions before we wrap up. Thanks everyone who's stayed to the end, and it looks like almost everyone has stayed to the end, so really appreciate it. This question here, it just prefaces it by saying, don't worry if you don't know fully across it. Does the Woolworths and Coles ruling last week regarding annualized salary apply to all industries? Is this something we should be reviewing now?
Yes, it is something that you should be reviewing now. It does. It will apply to all industries. Yes, it's going to have potentially a significant effect on many industries. There's quite a number of parts to that decision, and we are progressively, Citation as a group, publishing information and resources to help each of the sectors that we support to understand that decision. I wouldn't be surprised if it was appealed, but in any event, I would suggest an appeal is going to take a very long time, and so this is good law at the moment. So yes, sorry, that's the long answer. The short answer is yes, it does apply to your industry, and it may well have a significant impact.
Awesome. Thank you so much, Nicole. That's all of the questions that we're going to be able to answer live. If you just want to, just before we jump on to the next slide, please, anyone that wants to have that sort of in consultation with Citation Group, please scan this QR code. We're going to send it around at the end, so you've got a copy of it there. And just the same for ShiftCare. If we just jump on to the next slide. So ShiftCare, as I was mentioning before, we're a care management software, and we can help with a lot of the management and just making life easier from a compliance point of view. So a lot of the things that we talked about here, we're storing documents, keeping records, audit trails, etc. So as a software, not only do we manage sort of how you can look after the clients and whatnot, but also how you can keep records of everything. And so we keep records back for an extended period of time as well. So thank you again, Nicole. It was amazing. There's lots of the questions are just fantastic content, and thank you, and we really love it. So thank you so much for taking the time out to go through this with us. As I said, we're just sort of scratching the surface on the information here. Please reach out to the Citation Group if you do have more questions. Amazing bunch of people there, and amazing resource as well. We will wrap up there. We'll send the recording out with the questions answered in greater detail as well. Probably come out over the next sort of 24 to 48 hours, just while we get the information together. But sit tight, as long as you're registered, we'll get that information out to you. Nicole, anything from you before we wrap up?
No, but just well, yes, I guess don't hesitate to get onto Citation HR and ShiftCare to help you through all this. This is not BAU for you. You know, this is not your core expertise, it's ours. So if you need help, you know, reach out. We're here to help you, and you know, make use of these taste testers with Citation HR and ShiftCare. Thank you so much for attending today.